This is an Evergreen Media Network studio production.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor. Good afternoon, and welcome to Community Conversations. My name is Vicki Soulé, and I'm the CEO of Treasure Coast Community Health, where we provide primary medical, dental, behavioral health services, as well as pharmacy, x-ray, lab, everything in a one-stop as much as we can for your convenience. So if you're looking for a new provider, whether that would be a doctor, a nurse practitioner, a dentist, a behavioral health counselor, or just a lot of good friends, give us a call at 257-8224 and we'll get you set up. Every week I bring together new people, new maybe to you. Thankfully, I've cast a pretty wide network of friends and associates. And so this week, I'm happy to have Brenda, who is here from Hope Imaging, and her associate, otherwise known as the gal who makes everything run and pull together, Adriana. So welcome, ladies.
Thank you.
So one of the reasons that you're here is because you all at Hope Imaging have purchased some new equipment. But for those that are not familiar with Hope Imaging, Brenda, why don't you give us a little bit of background?
Okay. We're a privately owned practice. Dr. Ronald Cooper has owned the practice since 2013.
Okay.
And we have completed some new renovations over the last year and a half, and we have a whole new look. And we have added to our staff and our equipment. So we have two brand new 3D Pristina GE mammography machines.
See, it's contagious.
I know.
Sorry.
I know. It's a lot to say. And we've added a third ultrasound room. And we've done some upgrades to our MRI. So we've come up to the 21st century and have a very inviting office for our patients.
And so do you take patients from all over the county?
All over the United States, actually. As long as the insurance will cover them and they have an order, we will see them.
Okay. Now, at one point, mammography didn't require an order, I thought, in some states. It still requires a physician order.
That is correct.
Okay.
You're right. Some states don't require it. We do require it just because you are giving the patient radiation. We want to make sure that we're doing the right study as well.
Okay.
Because sometimes they're just there for their yearly, or if they're having issues, it would become a diagnostic. So we just want to make sure we're imaging the correct thing.
And I appreciate that information because, as Brenda just said, people come from all over and the rules can be different in different states. So if someone was visiting from out of state and they had had a previous mammography done elsewhere, or even in the state and done elsewhere, how do you handle that?
We actually request the priors. We do ask the patient. We get patients that are snowbirds, so they come from New York and they're here for a little bit, or Connecticut. We still reach out to the hospital trying to get the release of information so that they can mail us the CD with the images and the report. That way our radiologist can make a thorough read by doing the comparison.
So you do everything except sign their name to the form, I take it.
Exactly. Thankfully, most companies, they just see continuum of care and they help us out with the priors.
That's awesome. So what kind of insurances do you all take? Or conversely, are there any insurances that you don't take?
We take most insurances. We even take Medicaid, and we do work comp.
Okay.
We take a variety of them. There's actually a short list of the ones we don't take.
Okay.
One of them is Molina Medicaid. We take Molina, not the Medicaid part, or Aetna CVS.
Okay.
But we take most insurances.
The payments from the various insurances I know are just all over the map.
They are.
And so you can't very well accept an insurance that pays you less than your cost.
Yeah, there's a lot that we do take, though.
So if someone had insurance but not of the kind that you would accept and bill for, how do you handle that?
We do have a self-pay pricing that patients can opt to do if they can't go anywhere else that does accept it.
Okay.
Our prices are pretty competitive, but we do offer that to them.
And they can find your pricing on your webpage?
They could find it on Facebook, on our Facebook page.
Ah.
Yes.
Our websites, we have an active website that's up and running, but we're enhancing that. And until we have everything ready to go to launch it. So the new website will have who we don't accept as insurance and some of the scans that we do not perform. So that way it saves the patient time. Rather than calling in, they can just go to our website and get that information.
I know. The websites can be your best ally and your worst enemy as a business owner because some of them are rather difficult to update. And we can all understand that. As opposed to Facebook, where you just type it in and everything's wonderful. So what's your Facebook under, Hope?
It's actually called Hope Imaging New Page. We have an older one that's
page.
called that, but it was under different management.
Okay.
We haven't been able to update that one. So we created a new one.
Okay. I take it back.
And there's a lot of information
Facebook isn't
on
always
that.
wonderful.
It is once you could get into your account, but we did create the new one, and everything is posted on there.
Okay. Now, you mentioned that you take workers' comp. We had just been talking about mammography, so I just want to make it clear that those are two different topics, and we'll go back over to workers' comp and leave mammography to the side, okay?
Yes, sorry. I was thinking of all insurances of everything we do.
That's okay. It just takes me, I'm a little bit older, I have to twist and sort it out. Hopefully we'd never have a workers' comp case that also involved a mammogram. But what kinds of cases do come in the door that you can easily accommodate?
For workers' comp or just
for workers'
in general?
comp, yeah.
Well, for workers' comp, the company actually is the one that sends to us, or the physician. We can't do anyone just
walking in off the street.
Yeah, they have to have an authorization from them because you could only go to so many places.
Right, which is why I was asking what kinds of
but we do
things you might see. A lot of fractures and those types of things, I
yes,
presume?
or sprains. And most of the work comp stuff is for MRI. We do have an MRI machine and a CT, so it's mostly for that. Not mammo, like you said. That would be a weird
awful.
one. I'm sure it's happened somewhere, but it's mostly for
Those
CT.
airbags, you know. Sorry.
Yeah.
Let's go back to fractures and sprains.
That's funny. No, but MRI and CT, it's the ones that are mostly for work comp, but we do offer ultrasound and x-ray as well for other insurances.
Okay. And do you have a very long wait list to get people in?
No.
Oh, Brenda's shaking her head.
We are so proud of that. We answer the phones. We don't have voicemails or answering services or press 1, press 2. You get a live body when you call us. And if we can work it in, our mammos have been scheduled out. We actually had some availability for same and next day appointments, which is unheard of in this town. But
sure is. That's
why we're trying to get that word out, because we have 3 qualified mammography technologists. And the wait time is minimal and next day results unless there's a complication. So, and our schedules are filling up. But if anything, we might be 3 or 4 days out, but we can get you in.
That's fantastic.
And our office hours are for mammo is 7:30 until 4:30.
Okay.
So
you could come in before work.
Mm-hmm.
Not a lot of wait, in and out.
Not a lot of wait, in and out in 15 minutes.
Woo!
Yeah.
Wow.
We have a really well-ran machine.
That's phenomenal.
Just the whole process, we've streamlined so much.
So ladies, you've heard it here. You don't have an excuse that they were all booked up for months. If you were part of the October mammography month, then please get your mammos done. It's so important. I cannot tell you how many people I have seen and heard in various stages, and what a difference it makes for that early diagnosis.
And men need mammos too.
Yes,
thank you. Just as important. And unfortunately, we're seeing more male breast cancers in the last several months. There's been.
Yeah. So what's the symptoms? Because we all know guys don't want to go to any place other than places they choose,
right?
Like the
Right.
I
shooting
know they
range.
complain about a lump still or pain, so they
a
just
lump
get
and pain.
yes,
Okay, so don't
their
ignore
doctor
it.
thankfully does work them up for it. But it's still good to know, like if you're having any pain or anything that doesn't feel right, definitely let your
Well,
doctor
and it's
know.
usually the women that have to nudge the guys to go to the doctor
That is true.
that then work them up and
Well, and
get
the,
there,
the
so.
denser tissue for the male to have to really push in. And unfortunately, we had one patient just had a box fall out of the closet shelf onto him, and he was hurt. And he went to the doctor, and come to find out, they sent him for a scan, and stage 4.
Oh my goodness. Wow.
Yeah. So you definitely, it's pushing in and feeling. It's just self-exam.
Just like the women.
Just
How
like
about
Just like
that?
the women.
Well, ladies, we're going to take a short break for a word from our sponsors. And when we come back, we'll talk about some other very interesting things that you've got going on.
Thank you.
I'm not sure what. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, and all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Pollywood. We're having a big February clearance sale, which includes all Tommy Bahama and Lexington in stock or special order, 50% off. Sunshine Furniture, 1295 US 1 in Vero Beach, next to Planet Fitness. Family owned and operated since 1991. Visit our website at sunshinefurniturecasual.com, and don't forget to visit our outlet and sales store directly across the street.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule, and Community Conversations is what we do every week with different guests from around our community. And this week, I'm pleased to have Brenda and Adriana. I'm bad with names, I'm sorry.
That's okay.
Sometimes I'm just bad with speaking, so forgive me. But we're here to talk about the things that are necessary and now very convenient in Vero Beach through Hope Imaging. And we do a lot of imaging at our folks in terms of one-stop shopping because we have x-ray machines, but there's a lot of specialty equipment that you all have gotten or upgraded recently that we don't have. And so we spent some time talking about mammography. And so I think we've covered that pretty well. But next to mammography, if a diagnostic mammography is not sufficient, if there's still some question, then the next step traditionally is an ultrasound. And you all do that as well?
Yes, ma'am, we do. In fact, with every diagnostic mammo, it does accompany an ultrasound of the breast. So we do offer that, and we do offer other ultrasounds as well, not just of the breast. We do breast biopsies under ultrasound guidance with a radiologist.
Okay. But that again is towards the end of the diagnostic journey, correct?
Yes.
Okay.
Yeah, that would be the final.
And then
that's in case they find something that may look suspicious, and the ordering doctor feels they
want to actually look at those cells and see
exactly
what stage are they? Are they benign? Nothing to worry about. Okay.
Exactly.
And are those booked way in advance, or is that something that? Because I remember long time ago in a land far away, you have cancer became like the Snoopy thing. You didn't hear a thing after that. So my knee jerk was, let's take care of this like right away. Is that possible?
We do try to schedule the ones that are high risk that the radiologist believes are high risk. We do try to put them on the schedule almost right away.
Okay.
It's probably 2 weeks out for biopsies.
Normally.
Normally.
Okay.
Because they're only done by a radiologist, so he obviously has to be in-house and all of that. But it's not a very far wait.
Okay. Unless it's you.
That I was just going to say, unless...
And then the clock
that's
ticks.
the one thing that I'm very proud to say, that if a patient is really in need, Adriana is the miracle worker. I mean, we figure it out. She will look and get creative on the schedule, and as long as the patient's, available and willing to do it, Dr. Cooper's always gone above and beyond if it's something that's at that level of urgency.
And truth be told, I think most individuals who've been scheduled and then are asked to reschedule so that someone can slip in on an urgent basis, as long as they know that's what's going on, I think most people are A-okay with it because they want to be treated the same way.
Absolutely.
So ultrasounds could be for a variety of different things. During the break, you mentioned DVTs.
Yes, to look for blood clots in the legs. A lot of doctors refer us their patients for that because it is an urgency. If you're having leg pain or they feel there's swelling, it could be caused by a DVT.
But not all swelling or leg pain is
not
a
always.
positive DVT.
No, not always, but they're cautious. They want to make sure that they do right by the patient and make sure that it isn't a DVT.
Okay.
More likely than not, it's not.
Yeah,
from what the techs have said in the past, but it's still good to check and make sure.
Absolutely, particularly if you have insurance, and or I would imagine if you have any kind of history that would go along with that as a potential diagnosis. So those head to toe basically for ultrasounds, anything is possible because it's sound waves.
Yes, ma'am.
Okay. What other types of things are you doing? The next steps up. We've talked about mammography and we've talked about ultrasound and the biopsies, but you also have a CT scanner.
Yes, ma'am. We have a CT scanner. We also do X-ray, bone density, and MRIs.
Ah, okay.
And our CT business is increasing. We're very happy about that. That too, we can also offer same-day appointments for the most part, if it's without contrast. But a lot of the physicians locally have their own CT machine, so we didn't think we would ever fill the day, but it's happening, so we're very happy about that.
Well, of all the modalities, I have to say the most intriguing and the one that I have the highest confidence in personally is a CT scanner because it's like slicing a loaf of bread. And so with those various scans coming up, it's really difficult not to get the idea of what's going on, and it's very hard to miss something on a CT scanner. My personal opinion. I don't have MD after my name, but
enough experience.
Enough experience to say that is of all the scans. Now, MRIs are also very good, but the technology is very, very different. And so, are you seeing more MRIs than CTs?
We usually see a lot of MRI because it just shows differently than a CT. Like you said, I don't have MD behind me, but I have been an MRI tech for 10 years. So it does
more about the musculature?
Musculature and ligaments. That's how you can tell if you sprained your ankle and if you tore a ligament or in your knee.
I guess that's a big one here. All the weekend
Knees
athletes
are a lot.
Yeah,
Yes.
a lot of knee injuries.
Yes.
And one good thing that we've done is introduce Subtle. It's a software program that speeds up the scan time. So the scan times were 30
It's
to
shortened a lot.
Yeah.
So it helps with claustrophobia. We used to be, it would take about 20 minutes to do like a lumbar spine. Now we could do it in about 9. So for people that are claustrophobic, if they have to be in a machine for 20 minutes and now you tell them
even
9,
if you
it's a little
aren't
doable.
claustrophobic, I have to say,
Yes.
I've been in the MRI scanner, and I never thought of myself as claustrophobic. But
It'll make you.
yeah, I had to close my eyes and, kind of, you can't hum or wiggle around, but, just
No.
kind of go to the zone with my eyes closed because it is pretty tight in there. And they were making all these funny sounds, a click, click.
Yes, that's
kind
how
of
it
stuff.
very noisy. We have earphones for the patients, and we let them hear their music of their choice. So that helps a little bit, and even earplugs inside of the earphones. So.
Yeah.
Now, because of the need for most of those to be very still, do you see many kids? Since you brought up earphones, it automatically made me think of kids. Are there age limits on who gets what?
At our facility, we don't see a lot of children for MRI. Of course, they do have to stay perfectly still. So as long as you can, they could stay still for that amount of time. We have done them before, like 10-year-olds and 11-year-olds. Of course, the parents always in the room, but
but
as long as they
particularly
could
as
stay.
muscle sprains, tears, those types of things.
It shows a lot of different things. It depends what you're looking for, but yes.
Yeah, especially boys. I remember the 10-year-old falling out of the tree kind of thing. What were you doing up that far anyways?
Yeah, for kids, we do a lot of x-ray for kids.
I'll bet.
I'm sure you know that.
Unfortunately, with 5 boys, I do know that. We've spent our fair share, including one teenager who got upset and didn't want to hurt anybody, so he put his fist into the wall and then went, "Oh, that hurt," and had broken parts. So,
oh no,
yeah. What were you thinking was going to go on each one of their headstones if they didn't make it until they were 21? But they all did. Thank God. They all learned. So we've got just a couple of minutes to wrap up. Anything in particular you want to share that I haven't asked or that you didn't think about yet?
Well, we do walk-in x-ray and OB. Mention that real quick.
We're going to be starting to do OB anatomy scans for pregnant women at 20 weeks. I do want to share that we are privately owned. So we answer our phones like Brenda said. We don't have an automatic voicemail or anything like that.
So people can just walk in and talk to you and
walk in and schedule, walk in and talk with us.
Okay.
We want to help the community get their diagnostic needs taken care of.
And we've made the office very warm, very inviting to where, because you're coming into the office, you more than likely have an issue. So if it looks very sterile, very clinical, the blood pressure's up and everything. So we've made it a very coastal, warm in appearance and very comfortable for the patient. And the reviews have been through the roof. We're very pleased with the transformation that we've done.
Well, and thank you both for making us aware of options in the county. Everybody needs choices, and it's wonderful that you have upgraded your equipment, your room, and your customer services beyond
and
belief.
Staff. We now have over 30 employees.
Wow.
Yeah, we were at 15 a couple of years ago.
Well, that shows that the community is responding to you, and so I appreciate you being here today, and I wish you nothing but the best of luck.
Thank you very much.
And thank you all for staying with us to the very end, and I hope that you'll dial in again next week, 4:30 Saturdays. We'll be here every week, so have a great evening all.
I told you it was